Hello, my name is Stacy Buckley, and today I'm going to talk about a change that could genuinely transform how we deliver care, and that is bringing trauma-informed care training to every part of the hospital, not just the psych unit. So we know that trauma is incredibly common. Many patients that walk through our doors, whether it's the ER, the ICU, or med-surg, they have a history of trauma, and a lot of times it's not documented. It's not something that we see in their chart, but the problem with that is that a lot of healthcare staff don't recognize trauma responses when they happen. So what looks like non-compliance or agitation or even aggression might just be someone's survival mechanism. So without realizing it, certain procedures or tones of voice that we use can re-trigger that trauma, leading to more agitation, mistrust from the patient, or even more aggression. So at the same time, I think a lot of staff are under pressure and emotionally taxed, especially in those high acuity units, and that creates a cycle of stress for everyone. And that's why I think moving towards trauma-informed care is not just about doing what's best for the patient. It's not just about patient compassion. It's also about safety and sustainability for the healthcare workers as well. So the change here I'd like to see is mandatory trauma-informed care training for everyone in the hospital. That's nurses, techs, physicians, dietary, security, everyone who interacts with patients. Because if we really want to deliver that holistic, patient-centered care, we have to understand what people bring with them when they show up in a crisis. And if they're at the hospital, then this is a crisis for them. So trauma-informed care asks us to shift our mindset from what's wrong with you to what happened to you. And that's a small change in words, but it makes a huge impact, and it matters how we approach people. So the framework for this is Lewin's change theory, and it has three parts: the unfreezing, changing, and refreezing. So the unfreezing would be, let's start by raising awareness for trauma responses, and this might mean showing real patient stories, the staff experiences. They can talk about things that they've seen with patients getting aggressive or whatever, and then have data, talk about the data about how trauma affects recovery and how it affects the way you communicate with people. And then the change part, that's where we actually roll out the training, workshops, maybe online modules, simulations, maybe. The focus could be on communication, empathy, boundaries, and emotional safety for the patient as well as the healthcare worker. And then the refreezing part of the theory is that's where you just make it stick. We integrate that trauma-informed care into policy, new hire orientation, annual training. So now it's a part of the whole culture of the hospital and not just a checkbox that some training that you had somewhere along the way. So to plan the change, I think to do it effectively, we first do a quick needs assessment, maybe like a survey, and find out what staff already know and where the gaps are for trauma-informed care, and then collaborate with mental health professionals to create maybe some short, realistic modules and have people work through those. We could even build it into required CE credits, so you're kind of more encouraged to do it rather than feeling like it's optional. And I think the buy-in would be, and the key would be if people can see that the change really would benefit everyone. It would reduce patient aggression, improve satisfaction scores for sure, and then support staff mental health, which is important. To implement, I think we could start with a pilot program in like a high-stress area, like ICU or the emergency department, since those are the teams that most likely face crisis situations. And then we could have like role-play scenarios, debriefs and feedback loops, and see how it's working, and just try to make the training stay practical. And once the results are there, once it starts showing results like fewer restraint incidents or staff reports of improved interactions with the patients, then we could expand it hospital-wide. To sustain the change, we got to keep it going long-term. Trauma-informed principles should be part of the hospital's foundation, like we said, part of the new hire process, baked into orientation, performance evaluations, and even leadership when they're communicating should, their phrasing should incorporate trauma-informed focus in the way that they communicate with the people, the employees. Of course, there'll be barriers, and so I think some barriers and some solutions to that would be, the first one's probably going to be the most common thing that you're going to hear is like, we already do this. We're already nurses, we're already healthcare workers, and that's understandable because most healthcare workers, they do try to be kind and they are patient-centered. But trauma-informed care goes beyond that. It's about more understanding the biology of trauma and how just those little communication changes and little behavior changes and maybe posture changes, and how that makes a big difference in whether it triggers a response or calms a response. So even small changes can make a really big difference. Another barrier that we're going to see is time. I think everyone's already stretched thin. No one wants to do more training. So to work around that, we need to design short, flexible modules that already fit into the scheduled education hours that we already have to be a part of. And then the last thing I think will be burnout. Staff can't pour from an empty cup. So the trauma-informed care should likely include self-regulation and emotional safety for the staff as well. So we're not adding to the burnout, and it's actually helping to reduce that. And so that's really the heart of it. I think trauma-informed care isn't something that's brand new, and I don't think it's overwhelming. It's what we're already doing, but with an understanding and an intention behind it. So the goal is not to add more to what we do, it's to make what we already do mean more. So not more work, but better work. Thank you.